Hello and welcome to the Doc Podcast. I'm your host, Dr. Mike DeLuke, and it's my mission to help you lead a happier, healthier, and more prosperous life, both personally and professionally. Hello and welcome to this episode of the Doc Podcast. Today, I am thrilled to be joined by Dr. Susan Maples. Dr. Maples is an amazing general practitioner who has practiced in Holt, Michigan for more than 4 decades. She is an international speaker on total health, the oral systemic connection, and America's growing diabetes epidemic. And she teaches widely on leadership, team building, advanced case planning, relationship-based marketing, and cultivating healthier kids through dentistry. She was inducted into the American College of Dentists in recognition of her leadership in professional ethics, and she continues to contribute to ethics and practice management education at the University of Michigan School of Dentistry. Dr. Maples has fully embraced the challenge of helping dentistry take its rightful place in addressing the U.S. health crisis and co-led an award-winning study on detecting diabetes in the dental office. She is also an outstanding author and has written 2 notable books. One is a consumer-focused book on the mouth-body connection titled Blabbermouth, 77 Secrets Only Your Mouth Can Tell You to Live a Healthier, Happier, Sexier Life, as well as Brave Parent, Raising Healthy, Happy Kids Against All Odds in Today's World. In addition to her extensive work in advanced restorative dentistry, Dr. Maples has always been passionate about treating children and even created the nationally recognized hands-on learning lab kit to elevate children's oral and physical health, and we will discuss that more during today's show. Beyond her clinical work, she frequently speaks to community organizations and schools about children's health, writes a monthly column for Healthy and Fit magazine, and contributes to publications such as Dental Economics and the Journal of the Michigan Dental Association. She is also an avid fitness and wellness enthusiast, which we're going to explore during today's conversation, as well as discussing how she became so passionate about taking a more proactive, holistic approach to patient care, the importance of a thorough diagnostic process to determine the etiology of all disease, the challenges we face with our current siloed nature of our healthcare model in both dentistry and medicine, how to effectively connect and communicate with ancillary professionals, including the use of what she terms, and I love, a health relationship coordinator, sleep hygiene, the gut microbiome, and much, much more. On a separate note, some of you may have seen the social media posts I put up highlighting some of the awards that we received from Spotify in calendar year 2025. I knew the audience had grown quite a bit, but I was truly humbled to see that we were in the top 10% and even top 5% of all podcasts on Spotify in multiple categories. I couldn't have done it without you all, the audience, and everyone's interest in this show. And I promise receiving those accolades only motivates me more to continue to bring you amazing guests and amazing content throughout this upcoming year. Thank you all so much for your support of the show. Please continue to share the show, pass this message along to others, and help us all lead happier and healthier lives, both personally and professionally. So without further ado, let's get on to today's show with Dr. Susan Maples. Enjoy the show, everybody. Welcome to the Doc Podcast, Susan.
Thank you so much. So nice to be here.
I'm so happy to have you. It was great meeting you, and I've known of you, heard of you. We'd exchanged a couple emails prior, but it was really great to meet in person at Palooza a few months back. And yeah, I just really enjoyed it. It was kind of fun because you spoke at the end of day 1, and then I was the beginning of day 2. And we had never communicated about our talks or what we were going to focus on. And Lauren does an amazing job with this, so maybe she knew. But they really did blend together beautifully.
Yes, and dovetail.
Yeah, it dovetailed perfectly into what I was going to discuss. And we'll really, a lot of both of those things we're going to talk about during today's show. But there were some really important common themes there. And that was the holistic approach to patient care, the proactive approach to patient care, the issues with the health and disease in our children today, and the need for dentistry and orthodontics to have a paradigm shift and a shift away from a reactive approach and towards a proactive approach. So we're going to dive into all of that today. But before we do, if you could just give the audience a little better feel for who you are and how you got to be the Dr. Susan Maples you are today.
Wow, thank you. I love the entire total health approach I've been in practice for 40 years, 40 and a half in the same place. So I've seen a lot of my young patients grow up into sick older patients. And I can't help but when I see people my age, I'll be 66 in a couple of weeks, I can't help but see that we could have really predicted and preempted so much of this. And I'm not just talking about airway health, but metabolic health challenges as well. The multifactorial elements that go into chronic disease states in our country that are, we think, 85% preventable. And how is that, how is it preventable if we're not practicing prevention in healthcare? And the last bastion of hope is dentistry, because we have these built-in preventive visits that the public is literally hoodwinked to think that we're preventing something in these visits when really polishing and scraping teeth is not prevention. So we can reshape that whole concept by taking advantage of the fact that we're front and center in a preventive modality. My background is, and I don't want to go into my whole story. It would take a minute, but I grew up a sick child with two parents who smoked 2 packs a day each.
Oh, wow.
My mom only smoked 1 pack a day when she got pregnant for me, but my brother is only 13 months older. So she was literally infant in arms and found herself pregnant and freaking out. And the doctor told her that if she increased her smoking, it would help her with her anxiety.
Really?
So she doubled her smoking while she carried me, which had a severe impact on my lung health.
Wow.
I was born premature with bad lungs and ended up in oxygen tapping first 3 months of my life, which you can imagine was not the best place for an infant to have an antibiotic to death, and then ended up with 52 allergies and a whole syndrome of asthmatic bronchitis, asthma, all of that. So I ended up hospitalized 7 times for pneumonia under the age of 12. Wow. I also had allergy shots twice a week. I was allergic to everything outdoors. So I ended up with a fairly sedentary lifestyle. I grew into a pre-diabetic, early weight gain from the antibiotics and the lack of activity. I had everything that we see today, only mine was unusual in that day, right?
Yeah, right. I was thinking that actually you were saying that. I'm like, well, nowadays people are thinking, yeah, but back then, 60 years ago, that's tremendous.
Yeah, it was 1960 that I was born. So by, that whole 1960s arena, you look at pictures, we didn't see the issues that we see now, including the microbiome issues and the autoimmune diseases that we talk about so frequently were not even a thing. In fact, secondhand smoke wasn't even a word, right? So at the age of 12, my mom was getting her PhD in counseling psychology and took a job at the College of Osteopathic Medicine. That's a fluke. At her first job, she was coaching unhappy medical students, which made me think, oof, never going into medicine. There are no unhappy dentists, right? I'm kidding.
Yeah.
But anyway, no, she wound her way through that medical school, finding someone who was young and finishing her residency in internal medicine. I had just had my last hospitalization. The pediatrician had deemed me too complicated. And they found an internist. They didn't have pediatric internal then. So an internist was a doctor trained for sick adults. And I became a patient of hers. And because she had time to work with me, she spent 2 hours looking at the root causes of my problems, which was unheard of then.
Yeah.
And then she started coaching me with lifestyle changes through exercise and diet to outgrow all of my problems. And without her, I would be probably not alive and certainly would never have been able to endure even the rigors of an education that it takes to get a dental degree, an MBA, and at 66 be practicing and speaking and on the road constantly. Like there's no way.
Wow.
So I'm so grateful, but also I recognize what she did in the time that she had with me, even the first 2 hours and meeting with me weekly after that, being curious and coaching with me one step at a time rather than telling me, here's what I think you should do, and I'll see you in 6 months, and I hope it works out. I mean, we drop the ball big time when we're able to set our own recare for someone. When do they would be the most opportune time for them to visit with us again if we're starting an approach to something that could be life-changing for them. It makes you rethink everything we're doing inside the hygiene visit, the preventive visit, right? And how often are those, and who determined when those are scheduled, and what can we do?
Right.
So we developed about 20, let's see, the hands-on learning lab is 27 years old now. We do hands-on learning with every child at every visit. So we do hands-on science experiences with them. We don't even polish their teeth because there's no efficacy in polishing, as we know, unless there's stain, and that's really just for appearance. We stain the plaque on their teeth with two-tone, and they choose whatever they would like to clean their teeth with, and then we work on skill development for them to do a self-prophy, a self-cleaning, and we mentor them while we record their behaviors, their knowledge, their patterns, what they're doing, what's their next step, what are they curious and excited about. And then our goal is to get them to 18 with skills, beliefs, and behaviors for a lifetime of oral health. But we moved that into oral and systemic health a long time ago. So for 27 years, we've been doing, in addition to that self-prophy model, hands-on science for every child at every visit. We have like 65 experiments that they do during the course of their career, their early career in medicine or dentistry in our practice. Can
you give a couple examples?
Oh my gosh, yes.
Yeah, like what sort of
so
things?
you want airway examples or metabolic health examples or oral health examples?
Yeah, anything you want.
So one example is we have if you're looking at just airway and tongue position, we have a little ball of silly putty, and we ask them to form the silly putty around any of three objects that they think would best mimic a flat tongue. And we get a large spoon and a little ball and a pacifier, and we start to have them form it. And we look at a skull, and we look at that very thin bone of the palate, and what's on the other side of that is the nasal cavity. And we look at the critical nature of having that be the shape of the tongue, and what is the role of the tongue in shaping that in a small child. We look at the sutures of the head in the skull, and we talk about that mid-palatal suture. We also look at the shape of that and talk about how that little pacifier was, whatever shape the parent decides to buy in the store is what determines that the shape of that bone, and how critical it is to be able to get the tongue up there. So then we look at their tongue position and whether their tongue feels like it's flat up against their palate in a resting position, and if not, why not, and what can we do? It's not myofunctional therapy. It's just an experiment, right?
But they're developing the sensory awareness.
Yes.
Yeah.
Yeah. So that's just one example. I know you're into airways. I picked that one, but there's so many.
Oh, that's
because
so great.
of that, by the time a child's graduated high school, they've literally looked under a microscope. They've done salivary diagnostics in their own mouth. They've used a diagonal dent. They've placed a sealant on an extracted tooth. We have 52 of our patients are now practicing dentists, and we got 3 more one's waitlisted, but we have 3 more acceptances this year. So we're, because by the time they graduate high school, they know all about what is caries disease, transmission of bacteria through saliva. They've done, it's crazy what they know. Acid-based chemistry, and, but they also do a lot with hydrogen and fat, with high fructose corn syrup. Like we do a lot of metabolic stuff too.
How did you start that? And that's just fascinating to me. And I just want to acknowledge for a second here before I go into the question. That is amazing. That is the type of paradigm shift that I often talk about that we need in healthcare in general, but especially in dentistry. And the fact that we're trained like these robots who go through school. And it's like, okay, like you said, we do this 6-month prophy, and we do this often, and we treat every patient the same way. And we don't take the time to involve the patient and the patient family, in the case of the kids, in this whole process.
We do what we think is education, which is a one-way communication, and believe that we're doing the right thing.
That's fair.
Instead of facilitation, where we're learning what do they know first and what are they interested in learning, and what's the one piece that I could give them today that would make a lasting difference.
Right. We give maybe a pamphlet on like how to brush or like those types of things.
Or we brush the teeth on a model and we assume that they're going to be able to develop the skills to do that.
Right.
Or we suggest a power brush. We've never seen a power brush in their hands. We don't know how they're using it.
Yep.
But you asked a great question, like how did we think of the science stuff? I'm going to circle back to that doctor that was helping me. The very first meeting that she had with me, and I was like 13 years old, and she literally asked me, like, I'm sure you're tired of being sick and tired, after I was telling my story to her. And I really had never told my story. I was a tough kid. I didn't cry. I just accepted that I was just terminally sick, right? Not terminal, but, chronically ill. And she said, let me show you something about your lungs. She said, we're going to try to help your lungs heal without medicine. So she went out of the room and she came back with a little piece of bubble wrap, bubble plastic. And she put that in my hands and she said, what do you think this is? And I told her this was like 1973. So it was brand new. I said, oh, we love this stuff. It's, packing. So I popped it. She goes, oh, don't pop that. And I'm like, why? What's wrong with it? Is it like poison in there or something? She said, no. She said, this is your lungs under a microscope. All the air that comes into these little bubbles has oxygen in it. And in the little walls around it are where the capillaries live. And they pick up oxygen from the air and circulate it through the blood to every part of your body where you need it. And without oxygen, you're sick and tired. She said, look at these bubbles. Every one counts. These are clear. They have air in them. She said, yours are not clear. They have pus and fluid in them. And she said, and some of them are collapsed and small. And she said, we need to make sure that she said, all the medicines that you're using to inhale, she said, those are just trying to expand them to get more air to the rest, more oxygen to the rest of your body so you feel better. She said, I'd like to teach your lung tissue how to do that without the medicine. And I will tell you, Mike, I have never forgotten how my lungs function. And when I was in dental school and got to look under a microscope and see lung tissue for the first time in I guess it was microscopic anatomy, right? A histology. I was like, oh my gosh, I know all about you. And I literally got tears in my eyes looking at that going, I knew this from the time I was 13. I never forgot. And so the
did she do breathing exercise? What was
yes.
back then?
So she told me that we were going to work toward a half hour of cardiovascular activity or a day. And I was told I couldn't exercise because I get asthmatic bronchitis. So she said, I'm going to take you a step at a time. We're going to work with your lungs to develop more stamina. So that's where exercise became critically important for me daily, which I still is, right? Because I do it because I remember what it was like not to be able to breathe and not to be able to be strong. And so for me, it was preparation for a lifetime of health. And I associated it with that. But the reason that we wanted to introduce science is because I know that when kids have hands-on science experiences and they can see something like a skull or like a silly putty on a spoon or like a tongue function, they don't forget. I can tell parents about it. I can write about it in my Brave Parent book. The Brave Parent book, I subtitled Raising Healthy, Happy Kids Against All Odds in Today's World. And the against all odds part, some of my early readers were young moms like, oh, that sounds pretty shaming. I go, it's 100% true. 84% of school-age kids have tooth decay and it's 100% preventable. That's not healthy. That's a sign. It is against the odds to raise healthy kids in today's world. And we need to get to the kids, because I know personally that we put kids in the driver's seat for their own health. It is a game changer. It was for me, and it is for every child I know. They are worthy of being part of their own future, right?
Oh, completely. And Thank you for sharing your personal story in that. I know that's not easy to do. And I do believe that you, and hearing you say that, you were destined to do what you're doing, truthfully.
Oh, yeah.
You totally. Literally, I believe we all have a calling, and regardless of what people's beliefs are, what guides that we have a calling, we have a purpose. Those of us who are fortunate enough to find it, it's a blessing. And I do feel there are these little, call them God winks or coincidences, people will say, or ironic occurrences that happen throughout our lives. And I'm telling you, Susan, so many of the guests I have on this show will tell a story about their life, about their background, and it will tie into one particular person or a couple people or one place or one illness or whatever it was that you could have ignored that. So credit to you as well. But maybe you had, this person was put in your life for a reason.
For sure.
You still could have ignored it. So kudos to you for, as a 13-year-old kid, having the wherewithal, because you could have just been like, whatever, it's hopeless. I have this chronic disease and I've been told this by other doctors. What do you know that's different? That journey, think of all, because of, do you know her name? Do you remember her name? Would you mind mentioning it?
Yes, Dr. Zapp, Roberta Zapp, the APP. Yeah.
If Dr. Zapp hadn't influenced you the way she had, think of how many lives you have changed since you started what you've been doing in 40 years of practice. Think of the amplifying effect. And that is my why, and why I'm so passionate about this, because I believe even just one person that we can all impact, one child, one person listening to this show, one team member in your practice who sees the way you think and applies that in her own life or his own life, it becomes exponential in time.
And think about the exciting role for a hygienist to be able to champion these kids and to go home at the end of the day and see the difference that they've made, rather than just polishing teeth and getting out of the way for the dentist to diagnose some tooth decay. How silly is that?
Yeah. And I say that to my ortho colleagues all the time, that, and I don't say it in a patronizing way, and I really don't. I do feel sorry for my ortho colleagues who don't see things in a more proactive, early treatment and airway focus, oftentimes, but not always, approach, because I know that feeling that my team and I are able to have and got when we would treat a patient and change their life, for recognizing them for more than just their teeth or their malocclusion. And we loved, it's great in ortho office when you're creating beautiful smiles, it's fun. It is next level when you change the health and wellness of a child. And then when you see the impact that has not only on the child, but on the family, it's everything. And when you do it, it empowers everybody. It empowers your team.
Absolutely.
Right. And it's so rewarding. So one of the things I find with people is that they may believe in, agree with a lot of what you're doing or are saying, or I'm doing or saying. They struggle with how to implement it. Because the reality is, a lot of people are practicing for maybe a corporate or even if you're in a bigger practice and you're just kind of low doc on the totem pole, you're a new doc in a practice, or you're just in a small, you go join a family practice and your older family members don't think that way or practice that way. The days of being able to do a de novo startup easily are gone. It's still doable, certainly doable. I've coached and helped people through it. It's definitely doable. It's not easy though. It's definitely different. Even when I did it 20 years ago, it was easier than it is today. Or they're bound by an insurance company and what they can and can't do for billing. And they also are mired by significant debt. So I want to call out some of the challenges therein, because I know a lot of people struggle with that. They believe in a lot of this, but they just think, they hear you speak or me speak, and they'll say, yeah, great, Susan. I'm like, you guys can do that. You're establishing your careers. Must be nice. I'm here fighting the fight every day, just trying to pay my loans and get through my day. What would be your advice to those people to help implement this change?
Oh my gosh. Where do I start? First of all, you mentioned money bound by insurances. I'm a pretty fearless person. When I say that, I always try to make decisions from an integrity standpoint and just know that if I'm doing the right thing, it's all going to be fine. Mm-hmm. And so I dropped all insurance, contracts in the year 2000, Independence Day 2000. It's been 25 years, and I'm in a very
ironic day
area.
You picked for that
on purpose.
Oh, good for you.
Yeah. Independence Day, and we did that without money as a driving force, because what we really wanted to do is get the insurance company out of the way of doctor-patient relationships and hygienist-patient relationships. We wanted to help them do the right thing. And we still bill their insurance and try to get every last dime from their insurance company that we can for them. So it's a courtesy, but it isn't bound. And when you start thinking differently about insurance, you start to realize we have a lot of patients, believe it or not, who are homeschooled by one parent while the other parent's out making a living, and these people are typically not well off, and they all want every one of their kids treated for airway because they live on a farm, and they're wanting the best health for their children, and they have they're laser focused on that, and they don't have money to do it. But what's nice is because we're non-par, we don't have to deal with giving up a huge portion of our fees for them. And we also are not bound by these contracts that say that you can't help people who are in need, right?
Yep.
So 10% of what
or you can only help them in the way they say you can help them.
Yeah, right.
Quote unquote, air quotes, help them, right?
Yes, but 10% of what we do is for people in need. So we have a budget that every one of my team members can be generous with what we do and help people.
I love that.
Not just with 10% off, but maybe, half of it off for a particular family or something like that. So it allows us the ability to help a lot of people and still have a very lucrative practice. I think, working for a corporation keeps you poor forever. And I know that when I say poor, if you're paying student loans and you're trying to have a home and you're bound by that. I also like my team members to be well compensated and work on their retirement plan and help them understand. Many of them weren't raised with any financial education at all. So I like them. And how do I share profits with them when you don't have it yourself? You're just working alongside them as employees. So I don't know. That's a whole lot from my business perspective. But in terms of helping implement the science, I call integrate rather than implement, but integrate the science. One of the things that we need to do is to be able to see things differently and speak the truth about it instead of just hiding the fact that you see this, but you don't treat it yet. You don't really know what you're looking at. You have a suspicion there's a problem. How do you bite your tongue on that? Whether you're seeing a child slip into allergies, overweight, autoimmune disease, malaise, or you're seeing them with circles under their eyes and sort of ashen and sort of fidgety or struggling in school, and you never ask about airway. We know too much not to do that. Now, I don't want to guilt people for not being involved, but I do want to say, even if you've decided not to treat with airway orthodontics, or you're not going to treat nasal hygiene, or you're not going to do your mouth taping or trainers or, Vivos or whatever it is you're into, if you're not going to treat any of it, you still have some moral, ethical obligation to say something. Ask about mouth breathing. Ask about the chronic stuffy nose. You're seeing a child who's breathing through their mouth and they're stuffed up and they have circles under their eyes. You got to get curious. And they might say, "Oh, just has a cold." How often are they like this?
Right.
And then to get to the root cause of it, which means to sift through, have a conversation where you're sifting together through some, just staying curious about what else is there. And I have to tell you, it's getting worse since COVID. You'll see the research show this. COVID caused us to over sanitize our homes, stay inside even more. We've narrowed up our food supply significantly. We're 75% of what we eat comes from only 5 species of animals and 12 species of plants, and most of that is garbage, ultra processed foods with all sorts of thickeners and emulsifiers and colorants and flavorants, and preservatives, and none of that has been vetted out on human use. So we're seeing a sick population developing very chronically. It's not like they get sick overnight and they're throwing up from this stuff.
Right. And easier if they were, because I think we'd pay more attention to it, right?
Yes, of course. Anyone can eat a Rice Krispie treat and not get sick. But when you go back and look at what's in the marshmallow, what's in the Rice Krispies, and that's pretty simple. And then there's butter, right? That's not so hard, vanilla. But start to look at what's in a processed anything, chip. And anyway, so back to that, we have to help people understand that if you want to avoid allergies and autoimmune diseases, you need to introduce a variety of foods early, and we need to, have good ways to prepare whole foods and some knowledge about that. That's quick and easy. We need to know how to stock a freezer, refrigerator, pantry, and spice cabinet with foods that are healthful for a child to, all disease happens on a cellular basis. You need to feed the cells. So, and, we can handle, in an audience, I'll often get down on my hands and knees and literally lick the ground.
No way.
Yeah. I just lick it and I go, I just ate a bunch of dirt, and I'm healthy. So my body knows what to do with dirt, but you don't see me dragging my tongue along the whole aisleway from here to the door, right? That's what it's like to eat a bag of Doritos, literally bombarding your body with a chemical shitstorm. Like this isn't good for anyone.
Yeah. And how do you do that with your patient? What's your process look like? Because number one, I really strongly believe that this is the way of the future, and this is how we are going to the direction we are going to have to take our profession. And I so wish, and they're getting there, the ADA is getting there. They're trying to do more from my perspective. There's always more to do, but at least, it's a big ship. It's like redirecting the Titanic. It is a big shift. So I know we would love them to do a 90-degree pinpoint turn. That is not possible. And I think most of us understand that. We just want to see trending in the right direction. I would say the AAO and the AAPD leave a lot to be desired when it comes to any discussion of proactivity.
Absolutely.
Right.
And speaking of the Titanic, Bill Hang says to rearrange teeth in the same arch form is rearranging the deck chairs on the Titanic. It's still going down.
Right. Right. Like, it's exactly, we have to just think differently. And it's funny. I'll come back to in a second, the diet instructions and how you're incorporating that into your patient care. I want to just, since you mentioned that part of it, that's one of the big things too. We get so focused on these conversations and debates and arguments over extraction versus non-extraction, or early treatment versus not early treatment. And I've shifted my focus on this recently. I actually put an article out, which I'll link to in the show, because now it's on my website, but I put it out in my Doc Community Facebook group, and it got some really great responses. It was one written for the Florida Association of Orthodontists, where I'm speaking in March. And I wrote an article about what I call shifting to Ortho 3.0, which, if people have read Peter T. has outlived, right? He's got 1.0, 2.0, 3.0. And I read it a few years back, and I'm like, we're in the same boat in orthodontics, right? So
in dentistry as well.
In dentistry, completely. And so we need to get to that next level. And in that, when we're kind of talking about how we reframe that discussion and that debate, I said, we're having these arguments over and over and over again. I love the literature. I'm kind of a literature junkie, looking through the history of things. I'm like, we've been arguing about extraction or non-extraction since Engel and Case in the early 1900s. Enough is enough. And we've been arguing over phase 1 and phase 2. This isn't a debate over how we treat a problem in front of us. This needs to be a debate over how we try to prevent this problem from occurring. And this whole do it in 2 phases versus 1 phase and 2 phases and just charges more money and doesn't work. It's because the techniques you're using, as you said, you're rearranging decks, rearranging chairs on the deck of the Titanic. If you don't use appropriate technique in phase 1, of course it's not going to work. Nothing does. If you don't know how to prep for a crown properly and your crown margins suck, then guess what? Your crowns are going to fail. Like, it doesn't mean crowns are bad and you should never do crowns. That is the argument. It drives me nuts. And if you look through the orthodontic literature, when they talk about phase 1 proactive care not working, they talk about it only in the context of teeth, right? Nothing that you were just saying. So looping back to what you were just saying, how have you incorporated that once you had your mindset shift and you had your team on board, what does that look like to implement that into a practice?
Well, I have to give a shout out to two women, extraordinary women who've been working with our team for 28 years in retreat every year. We do a full-on 3-day off-site retreat on facilitation every year. Facilitation is the act of getting curious with patients instead of telling them what we know. So we stay very curious about their health, not through a health history, but through a verbal history. Tell me something interesting to you about your health, or your child's health, all of that. And through that, we follow their lead and we get to what are the issues that we really could help with. You see a lot of people I have a total health practice, so I'm going to attract people who are interested in health, but also you see that through facilitation rather than just bombarding them with, here's what I see, you get a lot. And we do this with children too. So our relationship with kids might look like, how are you, tell me how you're feeling about your body and how you're using it. And do you feel like you have all the energy you need and you feel like you're happy and you're doing well and you're well enough for you in your school and sports performance? Do you feel well liked by the other kids? Like getting to the bottom of what is it there. There's a whole lot of anxiety, as you know. 40% of school age kids now is like a disorder that was never even a thing when I was a child, right?
Right.
So we're starting to then get some ideas about what are the reported symptoms from the parents. When we're interviewing parents on the phone, when they call for an airway consult rather than coming out of hygiene, we'll ask also because these are often problem kids. These are not happy, well-adjusted kids.
True.
And I've never seen a child that didn't grow into the reputation created by a parent. And to hear a parent talk to me, who's now a perfect stranger to this child, and say things like, he's my holy terror. He's the problem child. And I'm like, oh my God, my heart breaks, because I was that child.
Yeah.
I was the child that felt guilty that my whole family was, I was in and out of the hospital, and it was terrible for my family. Like I felt always guilty for being sick,
Yep.
Anyway, we try to have conversations about what can they imagine they'd like to accomplish if they could accomplish it, and how can we be part of that? How can we partner with them? So rather than just doing an intermolar measurement and looking up their nose, which we do routinely, and reporting, they're underdeveloped for 7 years old, we need to do something now. And look at, there's no room for the teeth. Those are all like clinical findings, and those aren't necessarily getting at any kind of motivation for the parents unless they come knowing that they needed airway or expansion or something like that, right? We call it advancement and expansion, because not just a lateral expansion, but anterior growth and development too. And we do lots and lots of infant surgeries, and we get a chance to talk about pacifiers, pushing back, infant surgeries for latch.
Yep. Sure.
We talk about some of the pieces of this, like baby-led weaning and being able to chew real food, and the masticatory muscles, and how we can take advantage of what we're naturally given, and how we can take a very complex set of musculature that causes that breathe, suck, swallow into the future, so we can develop a face and a tongue that supports health. So if we can start early. So I guess there's a whole lot that we're doing in hygiene. When we start to notice things that the parent didn't notice, we start to give them like a screening questionnaire. The screener that I developed is on selfscreen.net, and you can just go on there and click on my name, which is the first doctor who has Total Health Academy on there, me. And then you can use all the screening tools, but you'll see the questions we ask. And that way we can write very, very good letters to the physicians and educate our medical colleagues as well. We have about 52% of our patients are referred to us by the medical world now.
Love it.
And a lot of that is through our Wellness and Prevention Study Club that I started about 15 years ago, but also because we write letters on behalf of these kids. When we notice things, we write letters to all of their doctors and we say, here are the parent-reported symptoms. Here are the physical signs. As a result of this, we're moving forward with whatever it is, right? Whether it's everything from tonsil or adenoid removal to airway expansion to looking at, nasal hygiene or mouth taping or myofunctional therapy, lip and tongue ties, I could go on and on, sleep hygiene. So there's a lot of things that we look at, a lot of factors, but we like to use, the physicians are required to read those communications that we write. That's a requirement on their part. So if I can write a really nice, succinct letter, I don't do it. My health relationship coordinator does it.
Can you talk about that for a second, that you have these HRCs, these health relationship coordinators, because it's such a beautiful idea. And in ortho, we have treatment coordinators. In most dental offices, you have a patient coordinator. And I thought, and it's so overwhelming to
What's a patient coordinator?
So for us, we would call really any of our front end team members for patient coordinators. And then we have treatment coordinators. So patient coordinators could have a kind of special area in finance. Maybe they're doing the contracts and they're handling all the financial side. We could have a patient coordinator that focused on scheduling and was the go-to for that. And then we had our treatment coordinators. And that concept of having those front end team members who are doing more than just like answering the phone and scheduling in today's busy office. It's like, that's not a thing anymore. That's going to be, sadly, I should say it is a thing some places, but in an office that's successful and thriving and communicating with colleagues, you can't have that in providing raving fan service. You have to have more than that and be better than that. But my treatment coordinators, when I started doing this, I needed to hire another treatment coordinator. When I started recognizing all these issues and communicating with my medical colleagues and communicating differently with my dental colleagues, because just the letter writing we had to do, and we built templates and systematized it. But it's a tremendous amount of work. So talk a little bit about having a designated person, a health relationship coordinator for that.
Yeah. So, I think most dental offices have what they call a front desk. They're my front desk. They're my front desk. They're not a desk. They're a person.
Right.
It's a little bit of a pet peeve for me because it's dehumanizing, but also I think we consider this part of the business team. Which part of the business team are the patient advocates? And where do they play a significant role in patient communication and also advocating for the patient in today's medical world, where we all need advocacy?
Yes.
The medical world is really, really stuck to disease management, looking at disease biomarkers and responding to that, usually with a Band-Aid, right? And
at best,
at best, we know this. But where do we help to educate? And we consider this part of our ethical responsibilities to educate our colleagues in root cause analysis, right? We want to take a look at all the root causes and then what can we do to mitigate some of those? And those letters become very interesting to them. The letters are only one aspect of the role of the health relationship coordinator. She also does the new patient intake. She has a desk. We have, again, one new patient coordinator. Our hygienists act as advocates as well because they're feeding the HRC the information they need to put a good letter together.
Okay.
If the hygienist is initiating that communication, then there's room for the doctor and the hygienist to sign it at the bottom, which elevates the role of the hygienist. Hopefully we're elevating the role because you look at what's happened with nurse practitioners and PAs in today's world. We've elevated them to do direct patient contact. And we absolutely need to be doing that with our number one preventionists in the whole world, which are our hygienists, if they can truly be doing preventive work rather than what they're currently doing.
Right. Just figuring out how many 45-minute scaling and root planings they can fit in a day. That's
drives
what it
me
is in most
crazy.
offices,
We are talking about perio right now, but even if you're looking at perio, the salivary diagnostics, not just white tight gums, but a microbial profile that predicts no more disease. I call this getting off the merry-go-round, right? Anyway,
love that.
Okay. So back to this. Together with the doctors and the hygienists, we give the health relationship coordinator enough information to generate these letters. And she also is doing our sleep studies and working with our sleep doctors to read those studies, making adequate referrals, whether it's for CPAPs or, because we do adult airway as well as a whole bunch of other metabolic stuff, A1C testing and all of that. So she's basically responsible for any medical sort of, I would say, any total health parameters that we're looking at to get to the root cause. She's coordinating that. We're doing allergy testing, and we're doing...
That's phenomenal.
Yeah, and we're taking allergies into our own hands for seasonal allergies, since this is the number one reason for chronic rhinitis.
Yes.
If we have chronic rhinitis or allergic rhinitis, then of course the patient can't breathe through their nose. They have to breathe through their mouth. And now we get distortion of the oral cavity, which ends up in our world. So you see, it isn't like, oh, you're not in your lane now.
Yes.
We're absolutely in our lane.
It's
we look up noses every day, and we notice their function, and we look at everything from deviated septum to turbinate hypertrophy to, inflamed mucosa. This is our arena.
Yeah.
Because it influences everything else down here, right?
Completely. And I mean, even if you just take it from the simplest perspective, if you can't breathe through your nose and you are mouth breathing, you have an element of xerostomia, right?
Yep.
Where, by definition, because we know that mouth breathing desiccates the oral cavity.
Completely.
We know
changes
with things
the whole
like
microbiome.
Sjogren's syndrome, right? That's a major problem in patients who have chronic conditions that cause them to have xerostomia. We are aggressive on it, right? We're trying to give them sialagogues and things that will help alter their salivary flow. Why don't we even talk about that? I mean, seriously, serious question. Why don't we even have the discussion of our ability to at least improve the microbiome of our patient's oral cavity? And we know decay. When we see, let me just back that, I'll ask a different way. We see a kid walk in with a 6-year-old child with rampant decay, right? Why is the way they breathe not in the forefront of our brain?
Absolutely. And of course, with rampant decay, there are multiple factors. When we look at this is an acid-base chemistry equation, and we look at saliva as being the number one source of the base, right? Mm-hmm, mm-hmm. When you alter the oral environment with airflow through the mouth, you're going to change the microbiome and the acid production, period.
Yes.
We're also going to not keep the teeth in a bath that would help them replenish. Mm-hmm. But it goes beyond that too, right? Because we're also looking at, of course, frequency of sugar and sugar consumption, which we've always looked at. We haven't really even, we swab to look at the metabolic output of the plaque itself, how active is the plaque. Okay. And, you can test for strep mutans. Also, we're looking at how do we get at the bottom, get at the root cause of this. But mouth breathing is a huge aspect of this as well. Mm-hmm. And we, everybody's focused on like MI paste, looking at replenishing hydroxyapatite, right? You can't put hydroxyapatite back into a tooth, no matter what's the particle size, if you haven't changed the pH that leached it out to begin with. Mm-hmm. We're literally leaching calcium out of the teeth to buffer the acid that it lives in. If you can't change the environment, nothing's going back in.
Right.
We know this from chemistry, right? So, and we can teach this to kids. This acid-based chemistry stuff, we put all the things that they like to drink in test tubes, and they use a pH meter, or they use litmus paper, and we literally we put a little tiny, tiny shaving of hydroxyapatite inside of a test tube of Mountain Dew and inside of distilled water, and we shake them up with a rubber capper. And an hour later, after a half hour later, while they're finishing the rest of their preventive appointment, we go back and look at it. And in the distilled water, the particles look like a snow globe. They're still intact. Mm-hmm. In the Mountain Dew, or whatever, 7-Up, it doesn't matter what it is, but Mountain Dew's clear and you can kind of see it. it's cloudy now. There's no more particles that stand up. They dissolve into to buffer the acid. Yep. So what does that do to a tooth, right? It dissolves your teeth. So we like kids to see it. You know, if we're not looking at, do they have acid reflux? 60% of us have reflux coming up. Mm-hmm. Are they consuming acidic beverages going down? Mm-hmm. Do they have a high inoculation of strep mutans that, by the way, is passed from mothers to caregivers to babies in saliva during that early years? Mm-hmm. Are they activating that by feeding it sugar throughout the day? And the combination of that with mouth breathing. So again, it's not all mouth breathing. If you go on Open Evidence, which is the coolest AI thing we have, which looks at the research, right? Yep. And type in, and I haven't done it recently, but if you type in mouth breathing and tooth decay, you might say, oh, there's not enough research for me to really say, because we can't isolate just mouth breathers. Right. We can't do a causative relationship on that. We can look at correlative data and say, yeah, a higher number of mouth breathers have a higher amount of tooth decay. But you could also go back and say, well, if they're mouth breathing, their mouth is dry, maybe they're sipping on sweet liquids to wet their whistle. Mm-hmm. We can't do that unless we eliminate.
Epidemiological data is just so hard to
it is. It really is. So anyway,
collect and analyze. Yeah.
The point is, as I'm looking right now at helping set up a research project for a dental student in our practice, which we've done before to get kids into dental school. What is it we want to study? I'm looking at what's one element we could study that would, with mouth breathing, that we'd really like to see. But there isn't enough research to really show. We do know that mouth breathing causes chronic nasal congestion and an altered microbiome in the mouth. But anyway, there's just so much we could say here.
Yeah, and the relationship between allergic rhinitis and airway disease is all throughout the medical literature, and we know it. Now there's an article in September that talked about rhinitis face, and I was talking with an ENT, and he's like, "That's not even new." And he's like, because I was referencing the article, and he's like, "That's not even new." And it's everything that you and I see, and that I teach and talk about all the time when I speak and lecture. We can see these things so easily. And this is even before you get into 3D imaging. And then that takes it to a whole nother level to see this. And I find so often our colleagues don't give enough time and attention to things like allergies, to things like nasal breathing and the importance of it. And the American Academy of Allergy, Asthma, and Immunology, they've estimated that up to 40% of children in the U.S. have signs and symptoms of allergic rhinitis or suffering from allergic rhinitis.
Isn't that crazy?
I mean, and then of that, there's one study that I saw that said that 80.81% of patients with children with allergic rhinitis also suffer from turbinate hypertrophy. So, and if you have turbinate hypertrophy, I can certainly well attest to that as a sufferer of 2 sinus surgeries and many, many, many problems with allergic rhinitis and what it's caused me. You can't breathe through your nose. And so we know the challenges therein.
And then of course we know that all of the antibiotics that we have for everything from ear infections, and a lot of that is a poor suck swallow thing, right? If your tongue's not crushing the palate and clearing the eustachian tubes, you're set up for ear problems and ear tubes and all of that, right? But then we get all of the antibiotics that go with this. These allergy things that we're talking about are, again, multifactorial. But why is it that when I was a kid and suffering from chronic allergies, I was a freak? Nobody had what I had.
Yeah.
And everyone smoked. So it wasn't like we shouldn't have allergies. We were around allergens all the time.
Yeah.
But our microbiome was tougher.
Yeah.
Yeah.
More diverse.
Our gut microbiome is about 50% less diverse than when I was a kid. And now you're seeing that huge, the number of just nut allergies in kids.
Yep.
And gluten sensitivity. These are things that just didn't occur. And if you go to, I just got back doing some dentistry in Kenya. There's no nut allergies there. None.
Right. Right.
Like
And very few gluten sensitivities in Italy and right, where they're growing their own food and not having this mass produced, genetically altered GMO type wheat and corn that is having these impacts. And that's the thing that I think people just need. I think it gets overwhelming for people. And in my particular case, I mean, I happen to have actually started seeing a functional medicine doc because my primary care was doing nothing about it.
Absolutely.
Ultimately, I had a terrible mold exposure when I was in dental school, like really bad. Lived in a place that was just black mold just coming through the ceiling and through the walls. And I never had a big problem. I always had like kind of, we called it hay fever as a kid, right?
Yeah.
Like if I got around horses or stuff I would get, other than that, I never really had issues. I never had asthma, anything as a kid. And it wasn't until dental school that I started waking up in the middle of the night and I couldn't breathe. I mean, like choking, can't oxygenate. And so
it's an awful feeling.
Probably again that those environmental exposures, but was I less resilient to that for some reason because of things in my microbiome? I mean, I had a roommate at the time, and he did not have any problems from it. He had a girlfriend, so he wasn't in the place quite as much as I was because he split time between her place, but still he was exposed. Didn't seem to bother him. So what is it in our species that is doing this? And I think that one of the things that's really fascinating as we, you can end up diving down all these rabbit holes, but the thing is that's how we have to think about this. And the way you and I are speaking is commonplace for us and some people in my audience. There are others in the audience and even and certainly outside of that who would hear this and they're like, dude, stick to straightening teeth, stick to filling teeth.
Well, and that's how you make money. Like, come on, I don't have time for these conversations. But here's the thing.
Yes.
I earned the right to do significant dentistry by leaning into their lives and helping them fix the root cause that was destroyed it. Like we don't have any business. I always say, like, if you had a house fire, you pulled up to your house and your house was in flames, your heart would sink. What's the first phone call you make? Do you call a carpenter to fix the roof while the flames are still licking away at the floorboards?
Yep.
Like, heavens no. You call 911, you put the fire out, you look for the root cause, and only then do you start to build a restorative plan. Because you would never rebuild around the problem that didn't get fixed.
Yes, which is what we're doing all the time.
All day long.
So how do you monetize
I earned
it?
the right to do that.
Because that's the thing, a lot of people, and I hate to make it about money. The fact is we're all running businesses and
How do I do that? I do comprehensive treatment planning and then offer some financial options for people and then get money out of the way and do the work.
Okay. So when it's a you're not like billing like for the service. You're getting away from, correct me if I'm wrong on this, because I'm understanding it. You're getting away from like, oh, that's a two surface MO filling and that mentality across all of your care. And this is a diagnostic a prophy, right? You're looking at it, you're creating because you're not bound by insurance, you're creating a comprehensive plan, putting a fee to that. They develop a payment plan that's comfortable for them, and then you focus on helping the patient.
Yep. We use Care Credit as a good third-party option for people, and they're wonderful, but we also give people a financial discount if they pay in full. So my accountant just called me and said, you guys are carrying about $90,000 of overpayment of your patients for this year. I said, yeah, that's right. I just had a guy pay for a $50,000 case, just paid for it. And he's in Invisalign to set before we do the restorative. We're doing a full mouth reconstruction, but we're creating more room first. And so he's in Invisalign for expansion while I create enough space. And so that takes about 6 to 8 months. But he just said, I just want to get it out of my checking account. I'm paying for it. So, how do we monetize it? We do comprehensive treatment planning. My new patient exam is 2 hours. It's actually 2.5. We leave about 2.5 because then we want time for them to work with the health relationship coordinator, look at financial options and look at sequencing of visits and things like that. But also, we do, again, with airway, even with pediatric airway, we're not selling the case in hygiene. When I say selling the case, we're not talking, we're saying, like, let's get together and have some dedicated time to look more carefully at this. And I'd like you to bring all caregivers that are decision makers for this child so that we together with your child figure out a plan to move forward. And then you're delivering a care package that might include what is it going to cost to complete this? I don't want to complete this if we don't do. Once we change, for instance, the shape of the tongue box, we need the tongue to know how to behave. So we have to build in some myofunctional therapy, whether you do it here or elsewhere. We're referring for that. We're setting up a plan to take a look at that, answer what questions they have about what their insurance will make. And when you say phase 1, phase 2, depending on the age, how far are we carrying them through this? And, if anything, we're probably just going to do a little bit of alignment later because we're creating everything that they need for success, right?
Yep.
So what does it look like to have a little mini Invisalign touch up afterwards, and how do we do that, right?
Yep.
So all of that, answer all those questions. And we're then letting them take some time to think about that and getting out of the way so that we can have them make a good decision and make a commitment. And that's how you earn the right to do the dentistry. And no judgment. I'm there to help them, even if they can't afford to move forward right away. I might say, here's a step that we can do. I'll get them in like the little Vivo Start or something if they're a little child, and just for a few $100s and get them going a little bit or get them into a Mile Munchie, or get them, or something where we'll work on nasal hygiene, or we'll work on that, or we'll refer to the ENT or whatever. But we can often do something and not judge the parent for not being able to do this right now, knowing that if we get out of the way, they're more likely to do it, so that we stop putting judgmental pressure on them as parents. Every parent wants their child to be healthy, right?
Yeah.
So I think this whole aspect, again, we work with Terry Goss and Janice Dupartey, and Terry and Janice. Janice just wrote a book on facilitation. It's fabulous. They work with our team on being able to generate, I'm a good talker, so are you, right? And I don't get paid to talk. I get paid to listen now, right? The more syllables coming out of the patient's mouth is the more that they're generating, and they're oftentimes being asked to talk about something they've never talked about before.
Sure. Yeah.
The more they're able to articulate that, the more they're hearing themselves saying, oh, we really have a problem here.
Yeah.
I don't know what kind of problem they have. I'm seeing the child for a few minutes, right?
Yeah.
They're going to tell me in their lives. And I want to say, how do we work together to create the very best version of your child that they're capable of in their life?
It's kind of like that Pankey co-diagnosis concept.
That's what it is.
Right?
It's not Pankey, by the way, but Pankey does teach at Mary Osborne.
Right. The co-diagnosis and taking it to the child, though. I mean, that I don't recall in reading about. I never studied under Pankey, but I've had people on the show who did, and we've talked about that. I don't remember it getting taken to the family and to the child to that extent. So it seems like taking it to that next level of the child. And how are patients? How receptive are parents and patients to it, and how does that change based on how early you get them? In other words, I'm envisioning that if you have them from the beginning and they're understanding this, it may be a little easier, correct me if I'm wrong, than if they walk in at 8 with Johnny and he's got a bunch of these problems and they don't want to look reactively into maybe some mistakes they may have made. It's very hard for a parent to acknowledge something's wrong versus proactively, where they could maybe try to do something about it ahead of time.
Even like at 13, look, I was ready to jump into it. When she said to me, like, I'm sure you're kind of tired of not being able to do blank. And I was like, yeah. And she's like, what would you be willing to do if I could help you get rid of your medications and live your best life? I was like, I would do anything. Yeah. So kids will be very apt to engage, and they're much smarter than we give them credit for in knowing they know more about their bodies than we do.
Yes.
We just have to get them to articulate, what it's like. Because they only have an N of 1, right? They don't compare. Yep. They've never even lived in another family. They don't know that it could be any different. They only have their body. So we have to help them see that they could be, feel better than they do now. And what would it take? So, for instance, you're doing some pediatric ortho, right? Airway ortho.
Yep.
So instead of saying, like, how are you doing with compliance, which is a word they don't even know. How are you doing with your expander? Instead we say, like, how are you doing growing that tongue box? Can you feel any difference yet? Now they're obviously their mouth is full of hardware, so they're not, but they know what we're trying to achieve. And we're talking about, we're going to give your tongue so much room that it can get out of the back of your throat. You're going to be able to breathe really well for the rest of your life, which will help everything from, your ability to run fast and to think clearly and to live your best life. right?
Yeah.
We want the big picture right there.
Yeah.
And what
Yeah.
else are they doing to support that? Trying to, eat good food to nourish their bodies and their cells. Like all disease happens on a cellular basis. So everything we can do to support good cell health, including, a good rich microbiome, honoring the bugs that we're lucky enough to have, and not tipping that scale toward pathogenic bugs, right? To keep good, healthy bugs, which means closed mouth. We also want good food to nourish all of our cells, all of that. Nice clear water that isn't tainted with high fructose corn syrup and other, artificial sweeteners and crap.
Yeah, God, the kids walking around on these energy drinks and, it's
caffeine,
just
unbelievable.
And the B vitamins. I had Stasha on the show recently, Gomanak, and she was talking about how a lot of it is the B vitamins that are in these, that they're kind of creating as much as the caffeine. It's giving them a bit of a surge of energy. And that's why they and then they market it as, it has vitamins and minerals, but they're literally just treating it as, in a sense, as a drug to be able to keep these kids going, and because they're not getting enough sleep. And actually on that, kind of in the last stretch here, I would love to hear your thoughts on, from two perspectives, how you address sleep hygiene with your patients, and then what your thoughts are on it yourself, and same with health and fitness. So for both of those two topics to finish up on, how you incorporate that in your practice, and then kind of what are some things you've, obviously at your age, you look amazing, you're in amazing shape, you've got a ton of energy.
Thank you.
I'd love to hear some of your, even if it's an N of one in your case, anecdotal data on what's worked for you, but then also how you help your patients in some of these areas.
So again, in the Brave Parent book, there's a whole section on breathe, Billion Kalmbach, a whole section on digest, which is microbial diversity, and they got a whole section, allergies and autoimmune problems, a whole section on sleep, and including a bunch on sleep hygiene. And then a whole bunch on daily movement, which is, if exercise came in a pill fashion, we'd be prescribing it to everyone, but it doesn't, not that easy, right?
So
you have
true.
to. Yep. And parents, in terms of kids, kids are great mimics. So the more you can model good behavior, the better.
Yeah.
Right?
Yeah.
So back to sleep hygiene. Everyone in the house should be looking at sleep hygiene. How do we create sleeping sanctuaries that are beneficial to sleep, knowing that that's where all of our cells rest and replenish and repair, right? Including our neurons. And as we age, we certainly don't want to lose another brain cell, right? So we have to take a look at how do we use sleep to our advantage there. Starting with caffeine, 92% of adults and 73% of kids between 6 and 12 years old use caffeine daily. It's sad.
Yeah.
That is a drug that has a 6-hour half-life.
Yep.
So if they're drinking, they go out for pizza and pop, and they're drinking Coke at dinner time, forget it. You are interrupting their sleep quality, right?
Yep.
And any kid that's been diagnosed with ADHD, which is just a list of syndromes that look, a list of symptoms that looks exactly like sleep deprivation.
Yes.
So of course, when you provide a stimulant to a sleep deprived child, they're going to respond favorably. It feels darn good to wake up.
Yep.
But
that's
then
why the pharmaceutical industry is prescribing it as early as 2 years old now, right?
Ritalin, Adderall, everything. Yeah. So with that on board, that's going to interrupt sleep quality. It's a stimulant that doesn't just go away when you shut your eyes at night.
That's such an interesting point. I haven't heard someone describe it like that, but yeah, the impact, it may be normalizing their behavior during the day in a sense, but the impact it's having on their sleep. Yeah.
It's further robs them of sleep, which may be the root cause of the problem to begin with, right?
Sure. Yeah.
So I think looking at drugs is important, knowing that caffeine is a little white powder that we sprinkled into a lot of stuff now. And a lot of college students and high school students are obsessed with energy drinks. Way too much caffeine. It's unbelievable.
Yeah, some of them have upwards of 250 and 300 milligrams of caffeine in one can of these things. I mean, I think a cup of coffee is like 60 to 80, and I mean, a normal size cup of coffee. So you're talking magnitudes, 400% what you're taking.
We're seeing a lot of emergency department overdose from pumping it into alcoholic beverages too. They put energy drinks inside of shots. And these kids are having seizures, not alcohol poisoning. They're going to the hospital with seizures in bar late at night, right? It's crazy. Anyway, we want to look at making sure that that their homes are cool. that we dial that temperature way down at night. And I know it feels like, oh, they want their child to be warm, but none of us sleep well in warm climates. We want it to be perfectly dark, no night lights, no, noise machines. We want it to be very quiet.
No phone next to your bed, right?
We want it to mimic what our ancestors, humans have been on the planet for 200 to 300,000 years old, way before incandescent light and electricity and noise. We want it to look like what it would look like if we were sleeping out there. So that's cool at night, and it's dark, and it doesn't have, and that we're not like that we're turning our incandescent lights down, our lights down as the evening marches on, not looking at bright lights and screens, right? That we're looking like what it looks like outside when it's getting dimmer, that we maybe have, candlelight with dinner and a dim light, and that we sit and have a conversation and read a book in dim light, and that we're not bombarding our brain. So these are creating bedtime rituals. And I also look at exercise, because when a body well used is a body ready for sleep. And on the days when I have to skip a workout, I'm not sleeping as well. Now you get into adults, and we start to look at hormone issues with women. This is a really big deal also. And then we start to look at sleep quality, where, by the way, we're starting to be much more open to hormone replacement therapy for sleep as well. But
thank goodness that came out with RFKJ and repealing that stuff. I knew that stuff. I talked to so many physicians even who said that 03 study, I think it was 03 in the Lancet, was just garbage. The Million Woman study, that there was so much poor data analysis,
but
yet it became pervasive, right?
Yes.
And
breast
now they're showing
cancer
it's the opposite, like it's going to decrease the risk.
Breast cancer is real, and you have to look at what else is going into that. Why are all these breast cancers? What are we eating and drinking, and what air are we breathing? I mean, there's a lot that's there, but to demonize the hormone replacement therapies was really sick.
Yeah.
Anyway,
anybody who I think the other thing I'll say about that is anybody who questions how little our health care establishment cares about us, and not to sound pessimistic on it, it's just the reality. Which is why these types of conversations and what you're doing with your patients are so important, because we have to fend for ourselves. We can't just expect the AMA or whatever to come out, or whatever federal organization to come out and say, this is going to keep you healthy. We have to do what you're talking about.
Absolutely. And to value sleep enough that when kids are having, or you are having a hard time getting up in the morning to your alarm, you need to go to bed earlier. Alarms are also a figment of our imaginations years and years ago, right? Now everybody has one, right in their phone. So this becomes an issue. I also think we really need to look at upper airway resistance syndrome.
Yes.
It is the precursor, and it grows right up into obstructive sleep apnea. But we see it with, it was sort of typified as thin, fit females, but I see lots of kids have flow limitations, audible breathing at night and snoring, and that's upper airway resistance. We often find that in those situations that we may stop breathing for shorter periods of time, have a RERA, an effort to breathe, and wake up. And even though we don't end up watching our pulse ox drop, right, our blood oxygen drop, we do deprive ourselves of slipping past REM sleep into the deep layers of sleep that replenish our body. So I think we're going to see a lot more ways to hopefully we'll see a lot more ways to do sleep studies that pull out this upper airway resistance syndrome, so that we can look at that as a something to predict and preempt in kids. And so there's a lot that we have yet to do, but in terms of sleep hygiene, getting back to basics, getting screens out of rooms, not looking at bright screens. And a lot of times parents will say, come home, you do your homework, and even the conscientious parents, you earn your screen time. You can do that later before bed. And now that ends up to be an issue, right? And kids that are allowed to go under their covers with their phone at night, texting their friends and, sneaking their phone in instead of having a depository, and like making rules early on and just obeying those rules. Like, I love the book, The Anxious Generation. My son, who's now going to be 32 January 2nd, was sort of the last generation of kids that grew up without a smartphone in their hands
for sure
in high school. And they're grateful for it, let me tell you. So the fact that we've enabled all these kids to have these little computers with them has ignited anxiety beyond control and behaviors, pornography and gaming and all kinds of addictive behaviors, social media, early on while their brains are still really being shaped. It's really sad. So you got to read that book if you're raising kids.
Okay. Yeah, I definitely will appreciate the recommendation. And I was a parent of the first group of children to have devices in their pockets as having a 19-year-old and a 16-year-old. So we were the first group of parents to navigate this. This was uncharted territory. We didn't know. This is new. And my wife's been amazing with a lot of the instincts she's had. Her occupational therapy background, I think, helped a lot with that and just good maternal instincts. But she had a rule from the beginning, and obviously I agreed with her, was no phones in the bedroom. When that phone stays and charges outside the bedroom. And just because even the distraction of it lighting up with a text or a snap or whatever it is that these kids have that they are looking at, we need to do a lot more. As you're saying that, I'm thinking, again, where are our medical schools and our medical establishment? Are they bought and paid for in this? Why are they not investigating the impact that these devices are having on our children's sleep alone? Like right there. Like, why aren't they doing more investigative work into the impact it's having on their sleep? As well as, like you said, the exposure to all of these stimuli on these young developing brains is so intense, and it's so unnatural. And I say that because we did not evolve this way. And it's preventing these kids from shutting down, and then the addiction and everything else. And I really do feel, so I guess the last thing to finish it up, do you talk to your patients about that side of it as well, into the phone use?
Absolutely.
Awesome. Wow.
Yeah. And we give a copy of Brave Parent to all of our parents. And I have to say, writing a book for parents this generation gets their information through Instagram and constant feed. They don't sit down and read books. So that book has become a resource, but I'll often point it out so that they can, because they all have it at home. So I'll point out like something I want them to read. But we absolutely have those conversations in the learning lab with children when we talk about the benefits of sleep. And I think, again, that a lot of parents struggle with sleep problems.
Fair.
So, and they don't feel
hard to
good.
Teach your kids when you don't know, right?
And none of us wants to be judged, our behavior judged on our worst sleep day. None of us.
No. Not
one of us, right? No. You're not at your best in any way. Decision making, clarity, communication. You got one nerve left and somebody's on it. Like it's frustrating for us to be sleep deprived. And so we get it. My generation was sort of like, well, we'll sleep when we die. But I often think the best graduation gift I could give a child now from high school is the little tip that if they pull an all-nighter the night before their exam, their cognitive ability will drop 30 to 50%. It's like, get a good night's sleep. That's the one thing I can tell you. Give up learning and go to sleep and you'll do better, just making better guesses even, right?
Right.
So our reasoning ability goes out the roof. So it's interesting that when you mention physicians, I have the good fortune to speak to the family practice residents at Michigan State University, and it's the residents are among the least healthy people I've ever seen.
Yeah, that's sad.
So how do you take the medical system it takes all the health out of these kids to me.
Almost takes pride in it. I feel like it's almost like this, right? It's like this hazing process. I went through it. You go through it.
Yeah. And then they come out and we're expecting them to deliver a health message when we've just made them really sick.
That's such a good point.
It's crazy to me. I look at them and think, oh my God, my heart aches for them. And the leaders will be like, oh yeah, it's pretty brutal what they're, and they can't wait to be done. And by then they have kids at home themselves. Right. And they end up just doing making sure their vaccination schedule's there, that they know how to treat the basic stuff and, all that. I just think we have a whole revamp of looking at health or what you say, ATIA's 3.0. Someone asked me to give a talk on the future of healthcare, and I said, let's start with where we are now in healthcare. The only thing wrong with healthcare today is we're lacking health and care. Other than that, we're fine.
We're doing great.
So the focus on caring for patients and focusing on health rather than disease, when you say I have a functional medicine doc, right? Or integrative medicine doc, or anti-aging medicine doc, or whatever, any of these health-focused people are going to help you dial in your health rather than just waiting for some weird biomarker to show up and now you need a chemotherapy or you need a something, right? How can we predict and preempt all that? And dentistry is in a beautiful place to do that. And I invite everyone listening to this to jump in at whatever level you're interested in. Look at yourself, your own family, your own children. Pick something that you're curious about getting better with over time and jump on that bandwagon. I promise you'll want to bring your patients with you. Jump in at any level. I have an online learning academy called Total Health Academy. It's designed to be eaten like the courses of a menu, right? Jump in wherever you would like to start. It's a monthly membership. So if you decide you want to try it for 6 months with you and your team and jump into one thing or another, or you want a learning lab, or you want to do a good infant oral health exam, or you want to look at pediatric airway, you want to look at diabetes or perio, or a new model for how to have a health relationship coordinator, anything you want, eat it one bite at a time and give it up when you're done. But jump in somewhere, because otherwise you're missing a major movement. The American Academy for Oral and Systemic Health started out just looking at bacteria and perio, but that organization has really richly developed a whole bunch of different directions. A lot of the airway people, AAPMD, have moved into a lot of total health stuff, not just airway. It all makes a difference.
Yeah, well, what a powerful message. I mean, I want to let you leave it with that, because that really is at the core of this. I think we get caught up so much in the X's and O's of how we do this. And fair enough. I mean, we have to deliver this to our patients. We have to be competent. We have to understand what we're doing. Certainly, we don't want anyone going out there and not understanding this and starting to give their patients all this random advice and screen for things they don't understand and don't know how to communicate or give their patients instruction. That being said, if you can take it a little bit at a time, use the resources that are there, which are getting more and more prominent throughout our profession. And in a second, ask for how people can reach out to you as well to get your contact information. But reach out to someone like Susan, myself, ask questions, and just start to think differently. I'm a big believer that if you start to think about this differently, everything else gets easier. If you go into it, right? I mean, if you go into it with this sort of, well, this isn't going to work, or, I'm a dentist. If that's your mentality, that's all you're going to be ultimately, right? But once you change that mindset and you realize you're a healer, you are a diagnostician. I mean, that's what we are. We aren't robots that just drill and fill teeth or straighten teeth. And you know what? In about 10 years, maybe not even that, there's probably going to be robots to do that instead of us. So how about we all wake up and figure out we can be so much more than these skilled technicians, and we can be the brilliant, empathetic, sympathetic, understanding, feeling diagnosticians that can help our patients live better, higher quality lives now and in the future. And when we can have that mindset change, I think the rest is going to start to take care of itself. And I'll let you have the last word with that. And if you would let people know how they can reach in touch.
I will do that. Yeah. Dr. Rachel Rahman is a physician that wrote some really amazing books. And her definition years ago of a healer was any person that can help another person see their wholeness better than they can at any given moment. And, when we have that vision for them and we can see it, and we want it so badly for them, it behooves us to ask more questions and be more curious about what they'd like to achieve in their life in terms of their own health and what they're journeying. And to be part of that journey is such an honor, such an honor. I know that at the end of all of our careers, we'll all have, I hope you'll feel like you have enough security, enough of a bank account to feel comfortable, not to retire, because I think that's overrated, but to do some of the things that you enjoy doing, to make choices that benefit you. But I also want you to look back on your career and your clinical team members' careers and know that you're all proud of what you've done with your time and energy.
Yeah.
It's not about a bank account.
Yeah.
It's about making such a significant difference. The fact that I'm talking about my doctor at 13 while I'm 66.
Think about that.
Think about that, right?
Mm-hmm.
What a career, right? To know that someone might be talking about me in their 60s. Aren't they lucky that they met me at a time in their life that was critical for them? Yeah. I mean, that's a beautiful career. So
yeah.
Anyway.
I don't think people may talk about you. I know people will be talking about you many decades from now because of the impact you have had on so many lives. And I just give you such credit for it. I'm not saying that in a patronizing way. I really do. The journey you're on, the fight you have in you after 4 decades doing this, to continue to want to push this envelope and get it forward, obviously for the benefits of patient care. It's just so admirable. And I really appreciate you taking the time to come on and share it. And
we're going off to our celebration with our team and spouses tonight, 19 of us in a bus, and I'm going to see a comedy show and go to dinner, and I will share that with them. This is it takes a whole team.
It does.
We do values-based hiring, and the people on my team share all of these same values, and they will be, I will pass that along to them. They really are the wind beneath our wings. So anyway, Susan at drsusanmaples.com, DRSUSAN Maples.com. My cell number is 517-819-6330. Brave Parent is available on Audible and the Blabbermouth book, 77 Secrets Only Your Mouth Can Tell You to Live a Healthier, Happier, Sexier Life. It's all about adult oral and systemic health. Mm-hmm. And Total Health Academy, you'll find that on the net easily too. So,
great. And I'll put links to all those in the show notes as well.
Yep.
Yeah,
so
well,
nice to be
so
with you.
Much.
Thank you for all you're doing. It's an honor to be with you.
Oh, thanks so much, Susan. Yeah. My absolute pleasure, and really appreciate it. Take care. And if you need me for anything as well, anything I can help you with, never hesitate to reach out.
We packed a lot in here. There's so much more we could do. If you start to have a podcast on business success and total health, count on me. I'd love to help people.
I do a lot of business episodes and things on finance and business, financial freedom and marketing. So maybe we'll touch base and in the future do one on that as well, because that's a big need as well. So awesome. Yeah. Thank you so much. I appreciate you.
Thank you. Back at you. Bye-bye.
Thank you for tuning into this episode of the Doc Podcast. Be sure to visit theorthocoach.com to get access to ADA CERP recognized CE courses or to schedule a private one-on-one coaching session with me. Also, if you know of someone who would make a great guest for this show, or if you'd like to be a guest yourself, please email me at drmike@theorthocoach.com. And be sure to join the Doc community on Facebook for more great content. Thanks so much for listening, and always remember, you have been blessed with the ability to do amazing things.